Why is diet important in patients undergoing total knee replacement? What to eat and what not to eat? Hi everyone, I'm Dr. Mohit Arora. I'm working as a consultant orthopedic surgeon in Miracle Hospital, Gurugram. I welcome you all in this video where I'll be discussing the importance of diet in those patients undergoing total knee replacement. Well, the goal of a good diet in those patients are to reduce the side effect of surgery, medicine and anesthesias, then to improve bone strength, muscle strength, then to maximize the wound healing, and the last is to reduce the chances of infection. Now we'll be discussing each and every point in details in this video. Coming over to the first point on how to reduce the side effect of the surgery anesthesia. So I always tell my patients there are certain side effects which are going to be there after surgery, like constipation. So we tell them to increase the fluid intake, to increase fiber-rich food in their diet, to eat lots of salads. Then to overcome nausea and vomiting, they have to eat small frequent meals. Then to overcome gastritis, they have to eat bland diet or very minimal spicy food. Now, of course, if things get out of the hand, we give them medicines to control all these side effects. Coming over to the second point, wherein we tell them to increase their protein intake to improve the muscle strength. Now, protein can be obtained through, in case of vegetarian people, through dal, through paneer, through soybean, quinoa, chia seeds, and for non-vegetarians, fish and lean meat and egg white are a very good option for increasing the protein intake in their diet. Now coming over to increasing the bone strength, we usually give them supplements like calcium and vitamin D, as the patients undergoing total knee replacement are in their older age groups. Calcium can also be obtained through natural sources like milk, through curd, yogurt, paneer, green leafy vegetables. Now, coming over to the next point, wherein how to maximize the wound healing, we give them vitamin C, vitamin K rich diet. That can be obtained by eating citrus fruits like amla, mosambi, then tomato, green leafy vegetables. Now, zinc is also very important. That can be obtained by eating pumpkin seeds and cashew nuts. Now, coming over to the last point, wherein the goal is to reduce the chances of infection. So we give antibiotics as a protocol after the surgery. Then if a patient is diabetic, we give the medicines to avoid any spike in the blood sugar. Now, what to avoid in the patients undergoing total knee surgery? Obviously, high spicy food, then high sugar intake, high salt intake, especially in those patients who are hypertensive, that should be completely avoided. No alcohol, no smoking. So all these things can be kept in mind for faster recovery from total knee replacement. Thank you.